Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm your host, Ashley Meservey. It's Medical Monday with East Cooper Medical Center, but we're taking this edition to the courts. Well, the Mount Pleasant Tennis Complex, to be exact. Today, we're discussing overuse injuries and what you can do to prevent these common ailments that, if left untreated, could lead to bigger problems down the road.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, Beth Maynor. She's a physical therapist at East Cooper Medical Center. Thanks for having me today.
Thank you.
All right, so today we're talking about overuse injuries. First off, what is that?
An overuse injury. An overuse injury happens when there's repetitive stress to a tissue to the point of breakdown in pain and injury. Most of these can be prevented, and that's where we come in with proper rest and recovery for the tissues.
Talk about how you educate your patients on all of that, because I'm sure they come in and they could make little changes to their life that would make a huge difference, right?
Absolutely. We see this in our culture with our youth sports. They're playing year-round sports specialization. It's recommended that you have 2 months off from a particular sport for your body to recover. And we're not seeing that in our culture, so I try to educate the athlete
and their parents, right?
I was getting ready to say that. That's huge. And they sense, I sense a relief when I'm teaching them this, because they're in that cycle of playing year round and the body breaks down.
And aren't the kids, their body's already developing at a pretty fast rate too, so that also...
They are, and they're not fully grown, so they have open growth plates, they're skeletally immature. We see this is just really tough on their bodies to do the same thing, the repetitive task, same thing year round.
So are you seeing stuff like shin splints and stuff like that, or what are some of the injuries that you're seeing?
Shin splints, fractures, stress fractures of the upper extremity in young athletes.
Wow.
So it's very serious to educate these families on how to rest and recover, cross-train maybe, play another sport. But we also see, surprisingly, with adult tennis, these overuse injuries and training errors. A lot of the women who come in who are in these leagues are playing back-to-back days. They're training.
And they're competitive with it, right?
Very
I mean, we see it right behind us.
They throw in a clinic on top of that, and they're just not giving their bodies a chance to recover. So we'll see tennis elbow, we'll see shoulder injuries, and that is one of the biggest things I do with them. I like to sit them down and plan out their schedule, their playing schedule, and help them revamp that. So
if for the parents at home and they're thinking, you know, their child's complaining about something, at what point do you think they should really consider going to see somebody?
That's a great question. I would take away the repetitive stress right away for at least 2 weeks, which in this case is tennis. If you're still hurting, please see somebody, an orthopedist, and then a physical therapist to help you.
Because you could really be making it much worse, correct?
Absolutely. We've seen so many fractures in the young athletes that we need to catch a little sooner. And then give them some ideas on how to tweak their training schedule and to get stronger, more balanced, more muscle balance to prevent this.
And the thing I love so much about tennis, it's a lifelong thing. So you're basically giving them lifelong tools, right?
If you do it correctly when you're young and train correctly, you can play for a lifetime. Sadly, if you don't, you won't be able to play this great sport
for the rest of your life. And so one of your big things is making sure people get back into the game as quickly as possible, but as safely as possible.
As safely as possible, as strong as possible, just so you can enjoy it and not be. A lot of people are predisposed to injury when they play this all the time. So we look at these postural changes and we try to correct them so they're not going to be left prone to injury when they go back out.
And then cause a whole heap of other problems, right?
Exactly.
All right.
It is my favorite thing to see.
I can tell you have a lot of passion about it.
And get back out.
All right, well, thank you, Beth, so much. And for more information, you can visit eastcoopermedctr.com.